The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hey, Shifties, welcome back to the next episode of The Shift. Today is a really exciting episode. I have a really good friend of mine, Jake Hawkins. Jake is coming to us from Baptist, and I just really like to quickly say thank you, Jake, for taking time to spend with me today and say hello to the Shifties and tell the Shifties a little bit about yourself.
Hey there. Well, my name is Jake Hawkins. Like you said, I am coming to you from Baptist Health, which is in Lexington, Kentucky. It's throughout all of Kentucky and southern Indiana, but my facility is in Lexington. And I come into nursing with a bit of a unique background. And I've been listening to your podcast, and every time I hear the shift, I think, oh my goodness, that is exactly what I did, down to the T. There was a day, I can remember the exact day. It was the first business day of January after a holiday break. I had had about 2 weeks off for a holiday, something we never get to say as nurses, and this was before I was a nurse. I'd taken 2 weeks off for Christmas, and it was my first business day back in the office, and I was working in public relations. And I had a lot of clients during that time that were in the healthcare space, and one client I had specifically was a academic medical center, and this client wanted us to really feature some of the research that their physician residents were doing. And so, as part of that, I needed to go to the academic medical center on this first business day of a new year and interview some resident physicians. And so, I did that with the worst case of Monday-itis in the world, coming straight off of a 2 week break. And I go to this academic medical center and I start interviewing these physicians. And the whole time I'm listening to them, I'm thinking, what am I doing? It had been in the back of my head for my entire life that I wanted to be a nurse. And I was listening to them and I was just like, I've got to make this shift. It's something that I've been thinking about, saying, I've already got a degree. I don't need to go back to school. Why would I do that? But I just saw the passion in these resident physicians' faces and what they were doing. And I wanted to be that passionate about the work that I was doing. I always had a job that I felt like I was good at, but I was never passionate at it. So I finished interviewing those physicians. I went back to my office, got back to the office around 11 a.m. And by 4 p.m. that afternoon, I was enrolled in anatomy and physiology and microbiology at my area community college. And I actually started those classes 2 days later. And by that fall, I was in a evening nursing program. And for the next 2 years, I worked full time in public relations and advertising. My employer at the time had no idea whatsoever that I was in nursing school because that industry is one with a lot of layoffs. Just anytime a client has budget cuts, the PR agency does layoffs. That's just how it works. And I didn't want to be kind of that first on the list, seen as one foot out the door. So I had to keep it a secret for the entire 2 years that I was kind of living this huge double life, PR professional by day and shifting into a nursing student by night.
So
And so
you, so Jake, you really are a little shifty and a little shady.
a little bit, I felt awful having, and I'm not one to keep secrets, but it ultimately was something that I just had to do so that I could fund nursing school. I mean, nursing school is expensive. Being an adult is expensive, and changing careers is something that I was only able to do because I was working full time. And so, whenever I went back, it was 2 years after the day I made the decision to go back to school. Is when I gave my 2 weeks notice, and I remember very vividly telling them, I very much enjoyed my time with them, but I was giving 2 weeks notice, and they asked where I was going next, and I told them to be a nurse, and there was a very big look of confusion. Well, you have to go to school for that. Well, actually, yes, and the reason I've left every day at precisely 4:15 p.m. without a second to spare is because I had to get to class every evening, and so. All good. It all ended well. They completely understood and were happy for me. But it was an interesting journey, to say the least.
That is such a fun story. So tell us, Jake, what was your first clinical job when you got out of nursing school?
When I got out of nursing school, my first job was at the University of Kentucky Medical Center in the Cardiovascular Intensive Care Unit. I started bedside nursing in January of 2020. So my bedside nursing career is actually not all that long. And if you remember January 2020, it was just a few months right before COVID. And so spent the first 2 years of my nursing career at the bedside. I'm taking care of patients on extracorporeal membrane oxygenation, or ECMO, whose lungs and hearts were so ravaged by the COVID-19 virus that they needed complete and total life support.
You know what's interesting, Jake, is I talk to nurses all over the country, actually all over the world, and I have found that many nurses that started their career like you did in the 2020, they immediately, I have one that I can think of, my cousin, her name's Paige, shout out to you, Paige. She worked at the University of Pittsburgh Medical Center. She was a CVICU nurse, and after 2 years of working through COVID as a new nurse and working through COVID, she now does something in an ambulatory clinic that's really very, very different. But, I always say this on the Shift podcast, that's why what's so incredible and unique about the nursing profession is you can make these shifts anytime you want.
Right.
Tomorrow you and I could decide to shift and go in and be CRNAs, or we could do legal nurse consulting. We could be nurses on a cruise ship if we wanted to. So that's the beauty of the shift in the nursing profession. So talk to me about one of the most profound shifts in your nursing career that landed you in the role that you're doing right now. And I don't know if we've mentioned this, but tell the shifties what your role is.
Yeah, so right now I am the Transition to Practice Program Director for our nurse residency or Transition to Practice program. So I've basically developed a year-long curriculum and oversee all those classes in our year-long training program for nurses in their first year of practice. So it's something that I really enjoy because it's something that was so important to me. And I find when you're talking about all of the various shifts we have available to us as nurses, that's one of the things that excites me so much about nursing, because I don't know about you, but I'm the type of person who I get bored very, very easily. And not only do I get bored, I get frustrated in anticipation of being bored. So if I'm in any sort of job, position, role, what have you, where I don't see the ability to change 1,000 times in the next 3 years, I'm going to be frustrated and feel like I'm unfulfilled. So the second I entered the nursing profession, all I saw were the many, many limitless opportunities and avenues for growth. And so that's been something that's kind of fueled my excitement, and something I share with new graduates every day.
That's awesome. And I love your energy and I love your passion. And I like what you said in the very beginning when you saw the passion in the people delivering care when you were still in your old role. And I think that's what's really so beautiful about the profession of nursing is it just feels really good when you're able to deliver care, and it's so meaningful and it makes such a difference. And I think that's why a lot of us, I was an ICU nurse too, Jake, and I'm kind of an adrenaline junkie. I don't know if you are too, but and I don't like to be bored either. That's why I started the Shift podcast, and now we have Shift merchandise, and hopefully you're going to have to send me your address, and I'm going to send you a Shift beanie because I'm pretty sure it's cold where you are. And what are some other things that you can think about in your career, especially in your role? Your role is so important. It's so important that when nurses transition from academia into practice, that they feel interested, involved, and inspired. What do you think your role is in doing that? And what is your role in helping new nurses create a culture of awareness for burnout? So I just asked you pick two questions and I kind of threw them all together like a big ball of yarn. Let me unpack that for a second. First of all, burnout. How do you address burnout, or how do you help new nurses start to identify, create a culture of awareness for burnout?
Mhm. I think that when we talk about nurse burnout, the first thing that we have to identify and really commit to every action that we take is that in everything that we do, we are still nurses first and foremost. And when I say that, I say it to point out that the nursing process still applies. And I know people are probably rolling their eyes to the back of their head right now when I'm about to say this, but we still, as nurses, we assess first. And that applies to our own selves every single day. And one of the things I tell my nurse residents every time I meet with them is you need to be assessing yourself constantly. And we all often forget that nursing process when we're applying behaviors to ourselves, and we want to just immediately evaluate ourselves. We want to talk down about ourselves, and we want to criticize ourselves and evaluate ourselves negatively with bad self-talk over and over again. And that really, in my mind, makes burnout so much worse because we're evaluating ineffectively, and we're also evaluating before we're ever even assessing. So the thing I repeat to nurses over and over again about burnout is to just be mindful that it exists. Even on your first day of nursing practice, some degree of burnout exists. You just got out of 2 years of nursing school where every test could have been an instant ticket to failure.
Right.
So that is burnout. That is a recipe for burnout. And so you just have to always keep in mind, keep in the back of your mind, what level of burnout am I feeling today, and keep that assessment going so that you can adapt your constant interventions and your constant self-care and your constant self-evaluation to match your current level of burnout.
The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout. Increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk. I do a presentation, a program called RISE, and it stands for Reignite, Inspire, Support, Empower. And part of the program is to actually have nurses do a burnout assessment. And I think you're spot on. It's fascinating. Sometimes people don't recognize the signs, the symptoms, what burnout sounds like, looks like, feels like. And that's how we create this culture of awareness. And really, burnout, it's not a problem, it's a dilemma. It's not 2 + 2 = 4, problem solved. It's a dilemma, it's a balance, much like balancing your patients with congestive heart failure. And so I'm really glad and excited to hear that you're starting these conversations early on in the careers of nurses, because burnout's real. And it's really causing a lot of struggles in healthcare. And now that we have 5 generations in the workforce, burnout contributors are different for all those different generations. So I don't know what you think about that.
Yeah. Well, it's funny that you
Yep.
say that, because something that can cause burnout for one person can be self-care for another. And I think about the differences between our baby boomers and our Gen Zs, for instance. The things that Gen Z loves to do is nothing but a factory for disaster and stress for many people of the baby boomer generation. And it's being that bridge and helping people see those perspectives, and also identifying that there's different avenues for self-care, just like there's different ways that burnout can manifest itself. And so each of those things are going to look differently, which is why that self-assessment is so important.
I agree with that. And, as I said, I do these presentations and talks all over the world. And what I hear from some of the baby boomers, technology is a big stressor for them. Managing the technology in the clinical care delivery environment, or managing the technology in a leader role, that causes a lot of stress that then contributes to burnout. It's interesting. I spoke to some millennials, and and I'm not saying every millennial, but often millennials will say, I have boundaries. When someone calls me to pick up an extra shift, I say no. I am a Gen Xer. I am in the hustle culture. And when I was a clinical nurse, they said, Andrea, can you come and pick up an extra shift? I was on it like Bluebonnet. So, all of the generations in the workforce make it even more difficult to find that sweet spot to balance burnout. I don't know. What do y'all call burnout in Baptist? I ask people this. Some hospitals call it life-work balance, work-life balance. I hear all different stuff. What do you call it at Baptist?
I think we talk about burnout a lot. I do find that we often talk more about the inverse, and that's resiliency and
Mhm.
just and self-care quite a bit. And that's generally when we're talking about burnout, we're couching it more in terms of the opposite, which is ways to prevent it. But it's definitely something that we discuss every day.
I'm glad. So, Jake, tell us, what do you think is your next shift? Now, I don't want you to say your next shift because you're maybe thinking of another job, because I don't want you to get fired on the podcast or because you were on the podcast. I'm kidding. But seriously, what is the next shift for you?
The next shift for me is actually coming up in just a little over a month, and I start my DNP program
I
in
knew you were going to say that. I
nursing.
knew it.
Yep. So I did not take much of a break. I finished my nursing degree, which was my second degree, in December of 2019. I started my master's in May of 2020. I finished my master's in 2023, and I took a year off, and I'm ready to start that terminal degree. And specifically, I'm really looking forward to what I think will be my research project. And I'm really interested in combining my background in writing and communication and shifting that into nursing. So one of the projects that I'm really looking at is this idea that we use a lot in writing, and that's called the hero's journey. And if you've not heard of the hero's journey by name, you've undoubtedly been exposed to it at some point in your life. And so the hero's journey is this theoretical framework of writing and fiction that basically says that every work of writing follows a similar formula if it is good writing and if it's writing that will appeal to humans. So think about Harry Potter, that follows a very defined formula. Wizard of Oz, Lord of the Rings, all these stories, they start with a normal world. Harry lives in a normal world under the cupboard under the stairs. Something happens to disrupt that world. A letter comes in through an owl. A tornado comes in and picks up the house, and then suddenly the normal is shifted, and now it's abnormal. And so you have to figure out how to get your way through that abnormal situation. But you're going to have help. You're going to have Dumbledore, the wise old mentor, or Glenda the Good Witch coming along to be your mentor, and I could go on. But needless to say, it's a very rigid formula that as soon as you hear about it, it really ruins every good story ever told because you realize it's the same story over and over again. And this is all to say we can apply that story and that framework to our careers as nurses. And that's one of the research focuses that I'm looking forward to expanding on, because what I want to encourage people to do when they enter the nursing profession is to write their own hero's journey. Because we as nurses, we've heard for the past 5 years how much each of us are heroes. But I don't think we always do the best job at writing our own story of what that means to be a hero. We have so many resources, no matter where we work, available to us through the American Nurses Association or other organizations. But we have to figure out how to pull those resources in to use them to help us on our journey. And we're not always the best about writing those stories. I think that's sometimes why we have people leave the bedside so early on in their career, because just like I said earlier, if you're sitting in a job and you don't see multiple different avenues of change and excitement and growth, you might think, well, I've got to go back to school or I've got to do something different. But many times it's just learning how to be creative to write that story, whatever setting you may land in.
I love it. So, at the end of most of, not at most, but the end of the podcast, I always ask the shifty that's on the podcast with me, we give a little nuggets, a little couple tips and tricks. And one thing is write your hero story. I
Yeah.
think it's brilliant. Listen to this. I had a guest, or I have a guest. She is a shifty. Her name's Ashley. She's from Boston. Shout out Ashley. And she was an ICU nurse during the pandemic, and she wrote a book called All We Have. I highly encourage shifties to read the book. But she did that. She came home and started writing down her story. It is a great book. It's so good. So
I
I
will have.
encourage everyone to read it. All We
Yeah.
Have.
There are
Um,
so many great nurse authors, so I love to hear that. I'll
yeah.
add to my reading list.
Yes. Do you have any other tidbit nugget that you want to share with shifties?
The only thing I can think of to add is that I really encourage every single person that's listening to this to just always pay attention to that voice inside your head and make sure that you're evaluating it as much as you're evaluating anything else someone else tells you. Your own internal monologue deserves as much critique as anything anyone else says to you. And so always assessing that self-talk is the thing I think we can always do better to help build resiliency and to help reduce negative feelings, burnout, all of those things. It's something that I think we just all need to be better about because there's no one else that can hear that internal voice besides us. So we have to be the ones that are constantly assessing that and reshifting it to be a voice that's more positive and more encouraging. Because when we let that voice go on autopilot, that's whenever it starts to say things that need to be redirected and corrected.
That's right. I love it. Jake, it was such a pleasure and so energizing to have you on the shift. Jake, I cannot thank you enough for your passion and energy that you brought to the podcast. I'm really excited to have you come back at some point. I can't wait to have you back and call you Dr. Hawkins. And just as everyone knows, we always end each episode of The Shift by saying, Shifties, remember, your shift makes a difference. Enjoying The Shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.